Barbara Heidenreich here from Good Bird Inc. with a tutorial on how to train your parrot to accept fluids from a syringe. I have a friend who's got a Nan-day conure that she's had for a long time, and at one point her bird got sick, and because he was sick he had to receive oral medication twice a day for 2 weeks. Now her bird wasn't trained to accept fluids from a syringe, so she actually had to grab her bird up to administer the medication every day. And unfortunately, even though her bird got better, which was great news, unfortunately the bird learned to be really uncomfortable about her hands and actually lost quite a bit of trust with her. And it's really too bad because it didn't have to be. All she had to do was train that bird to accept fluids from a syringe so that she could give the medication and the bird would take it voluntarily. Now, a lot of times we're not thinking ahead that this is going to be a problem for our birds, but in reality, that's the way a lot of medication is delivered for our parrots. So why not train our birds to take fluid from a syringe so when that day comes, it won't be a problem? Now this is the kind of response I like to see when I present a syringe to a parrot. Check this out. This parrot just runs right over to a syringe to get that fluid out of there, and that happens to be some baby food, human baby food I might add. Now he didn't give that kind of response right away. We actually had to train that. Now, I'm going to give you some suggestions on how you're going to train that behavior, but first you need some tools to train the behavior. And of course, the number one tool you're going to need is a syringe. And believe it or not, it kind of matters what kind of syringe you get. If you can, look for something called an O-ring type syringe. And if you just Google that on the internet, you'll come up with lots of different websites that offer those types of syringes. I would recommend getting a few of them. Don't just get 1 or 2. Maybe get 5, 10 of them kind of thing. So you have lots of them in case you need them for medication, but also in case you just want to use them for training, and maybe along the way some of them get damaged from training. You never know what could happen, but it's always nice to have a few extra. I would also recommend getting some different sizes because depending on what your bird needs to accept in terms of medication, you might need a different size syringe. So do get a few of those to keep on hand. Now, some of the training things you're going to want to know about is you want to make sure you're comfortable using a bridge or a bridging stimulus, or sometimes called an event marker. And all that is that's when you're going to let your bird know that he did something right. So say, for example, we're trying to get your parrot to touch that target, or excuse me, that syringe. We want him to touch it with just his tongue. And so far, he hasn't quite approached it. He's been near it, but he hasn't actually touched it. Your bridge is going to be really helpful. The moment he does touch it, you can say good, or you can click a clicker if you like to use a clicker to let him know that, oh, that's exactly what I wanted, and here comes a treat. Remember to always follow up your bridge with some sort of reinforcer, whether it's a food treat or a head scratch or attention or a little bit of excitement if that's what your parrot likes. But that event marker is really going to help you fine-tune this behavior, and you'll see a little bit more of that when we get on down the line here and look at some video clips. Now, another thing I like to use when I train is a jackpot. And a jackpot is just bigger or better reinforcers, and we use that for part of the behavior that might be particularly difficult. Now, I mentioned that when if your bird's afraid of a syringe, that he might not approach it, or he might be a little apprehensive about coming closer to it. So that first time that he touches it, boy, that'd be one of those moments where I offer a jackpot. And so it might be a couple extra treats, or it might be his preferred treat, or it might be a little bit extra attention. We don't want to go overboard on it, just a little bit extra to let him know that was even more important than just kind of hanging around the syringe. Touching it was even more valuable. We're also going to use a target to help train this behavior, and in a sense you're actually teaching your bird to target to the end of a syringe in the beginning stages of training this behavior. Targeting is just asking your bird to orient a body part towards something. You can see in this picture here, this little kayik is touching a chopstick with his beak, and then we can use that target to move him around. So say, for example, we want to get him to approach the syringe, we can use the target as a means to get him to walk closer and closer and closer to it. Here's a little example of targeting with a cockatiel, and she's learned to target to a fist. And so you'll see when she sees that fish, she knows she should walk towards it because she'll probably earn some good favorite reinforcers, in this case some millet spray. So some other things we're going to use to help train this behavior, one of those things is called systematic desensitization. And what that means is we're going to need to expose our bird to the syringe. And we don't want to do that in a way that creates a fear response from your parrot. So this is a really easy passive way to get your bird accustomed to the syringe. What it means is placing that syringe in the area where your bird is, but far enough away from him that he doesn't show a fear response. So this might be something that's just going on during the day while you're at work. You can place that syringe maybe 6 feet away from your bird's cage, so just so he can see it, but as long as his body language is relaxed and comfortable. And then maybe the next day you place it 5 feet away from the cage, and then 4 feet away, and then 3 feet away, as long as that bird's looking relaxed and comfortable. And eventually maybe it's right there next to the cage. So using systematic desensitization, you've helped that bird become accustomed to seeing the syringe. You haven't created a fear response, which is great. And so now you're a little farther along the line towards getting your bird to take fluids from it. It's the first step. Now your next step is you're going to want to start pairing some food reinforcers with the presence of that syringe. Obviously the syringe just sitting there by itself may not be enough for your bird to go over and check it out. Some birds may, because they might get curious about it, but some birds may go, ooh, that's a little too scary, I'm not going anywhere near it. So one way we can help reduce some of that fear is to associate something really special that the bird likes with it, like millet spray. So another thing we're going to use to help train this behavior is we are going to break the behavior down into tiny steps that your bird can accomplish easily and that we can reinforce. We call this shaping with approximations. So instead of expecting your bird to just go right up to a syringe and accept fluids, we're going to identify what those baby steps are towards that final desired behavior, starting with what your bird's willing to present right now. So if you look at having used systematic desensitization, maybe we are starting with the bird is willing to have the syringe next to his cage. So that's our starting point. Then what would our next step be? Maybe using our target to see if we can get the bird to approach the stick or approach the syringe. So let's look at what we would call a shaping plan. This is the steps we'd identify to get the bird to do the behavior. So we've already done the desensitization to the syringe. Maybe we've given some treats in the presence of the syringe. And now maybe we're going to try using that target to get the bird to bring its beak closer to the syringe. We'll reinforce, our next step would be to reinforce touching the syringe with the beak. And then we're going to have to fine tune that a little bit. We're actually going to have to try and get the bird to just touch the syringe with his tongue, because that's really where we want the fluid to go, right? It's not that we want him just touching it anywhere with his beak. We want this to get in his mouth. So once we've got the bird touching the syringe with his tongue, then we might try adding some fluid to it. Maybe we start out with water. Now, once we're not going to necessarily start putting water right in the mouth right away. We're just going to let the bird see that there's something in the syringe, and he continues to touch it with the tip of his tongue. Once he's doing that really well, we're going to let a little drop of water hang on the tip, and we'll let that bird taste those little drops of water from the syringe. And then once he's comfortable with that, then we might actually depress the plunger and start increasing the amount of fluid that's coming out of that syringe. So let's go back and look at some of these steps with some real-life examples. So here is a cockatiel, two cockatiels to be honest, who are getting accustomed to seeing a syringe. Now they've already gone through the systematic desensitization, and now we want to pair the presence of the syringe with some of their favorite food reinforcers. In this case it happens to be millet spray. And you can see the Lutino doesn't seem actually to be concerned about the syringe at all. She's very focused on chomping down on her millet spray. So we're going to try moving her just a little bit closer and see if that creates any kind of response out of her, but she seems to be happily chewing on her millet spray. And the male joins in too, but the male does notice the syringe there, doesn't he? He's like, ooh, wait a second, I'm not so sure about that. But after given a little bit more time, he starts to relax as well. But now we need to move on to the next step. Just being calm around the syringe isn't what we want. We also need to get that bird to touch the syringe. And for some birds, this can be pretty challenging. Now, you can do this with a target if you prefer. A lot of times I actually go ahead and use the food reinforcer to get this started. And then once they're getting pretty good at it, I'll start hiding that food reinforcer. So let's take a look at this cockatiel learning how to touch the syringe. So notice we'll use the food, or it could be your target, to get the bird to approach the syringe. The syringe doesn't come to him. We want him to come to the syringe. And I'm just gradually moving it closer and closer to the syringe. And if he gets nervous and backs away, then I actually move my food a little farther away from the syringe, and then we kind of start again. Because he's kind of telling me his threshold is that far. He's not coming at that point. So I don't want to push him for more than he's ready for. So here we inch forward or towards the syringe a little bit more. He gets nervous, so I back up a little bit, let him go a little farther away from the syringe if that makes him more comfortable. But it's this little dance back and forth that actually helps build a bird's confidence with this new experience. Okay, so now look how close he is. He's pretty close to that syringe. But again, notice the syringe stays still, and the bird is the one who comes closer. And that's because he's following that food reinforcer at this point. And he's pretty close, isn't he? So now what I'm going to start trying to do is really see if I can get that food close to the syringe, just like so that he might touch it with his beak, which he just did right there. And what we're trying to do now is position the food in a way that he might accidentally touch the tip of the syringe with his beak. And if he does that, then we get to reinforce him for that. And you see the food comes forward the moment his little beak touches it first. And that's how we teach him that it's really about touching the syringe that gets you the reinforcer. So what'll start to happen is we'll get more opportunities where he actually touches it first and then gets reinforced instead of having to have the food right there. And once that happens, we can switch to not showing the food reinforcer at all and just presenting the syringe, letting him touch it, bridging, and then bringing up the food to reinforce him. But getting them to touch it the first time can sometimes be challenging, as you saw there with that little cockatiel. So now that we're at the point where they're touch it, we want to get the bird to take fluids from the syringe. So here's where you're going to see that switch over. This is a macaw at the Gabriel Foundation. So this is a bird who was given up for adoption. So he's got a history of different behavior problems. And you'll see he's just like any other bird. He can certainly learn through positive reinforcement. So let's take a look at his training session. Notice it was just the tip of his beak that touched that. Also notice how far away she's holding that syringe. That helps prevent him from grabbing it and chewing it up. He doesn't have the opportunity to grab it. He can only barely touch it, and he gets reinforced for doing it. So he learns that that's what the criteria is. There, he got a tongue on it.
Sorry, bridged for you.
And then he got a little drop of water off of it that time, I think.
Excellent, much better. So we've got 3 times with the tongue there, so let's do that drop.
So here comes the drop of water. It's just a little drop hanging off the edge, the tip of that syringe. He got that drop, and he still gets reinforced afterwards. Now here comes another drop.
Yes, he is. He's in it, isn't he? I'm liking that.
Let's see what they have.
Oh, excellent. Did you get some water in there?
But I'm going to try
I'd say next time you might even press the plunger a little bit. Try not to press it too hard. You don't want to spray it down there.
No, like you said, we go away going, well, we didn't accomplish it. Yeah, you know how good this is for the bird.
Excellent.
And if you didn't accomplish your goal, that bird is around. That's the commitment. If I put it down, I now have a new commitment or a recommit. But if you put it up there, you go back and ask for more.
We got it.
He is slowing down.
You can keep going. I'm going to just keep going until my battery dies.
I'm trying to do it, right?
Oh, like that.
And I don't know what time we're supposed to end in. 2. I mean, I think in not a long time, with a little work, you can get going around 5 times, 1 reinforcer.
So you can see how this process works, where we go from getting desensitized to it to actually eating near it or getting some kind of reinforcer near the syringe, to actually touching the syringe, and then to actually taking a little bit of fluid from the syringe. Now, some tips to think about when you're training this behavior. If the bird is really nervous and you can't get him to approach it, remember you can reinforce him for just looking at the syringe. That can be a great place to start. Now, I mentioned this while we watched the video, but I'm going to mention it again because it's a difficult one for people. We don't really want the parrot to bite the syringe and get a hold of it and chew on it. So one of the things that you can do is you can hold that syringe far enough away from your parrot if you think he's going to try and bite it and chew it up, that he can just barely reach it, just like you saw in that video with the blue and gold macaw. When you do that, he doesn't have the opportunity to chew on it and create a problem. Now, if you accidentally bring it too close and the bird does get a hold of it and starts chewing it up, that's one of the reasons why you have extra syringes. We're not going to wrestle with him to try and get it away from him. Go ahead and let him chew it up, or you might see if he'll drop it for you in exchange for something else. But I wouldn't worry about trying to get it away from him. It's not going to hurt him, and it's just part of it. It was just a training mistake. So you'll know better next time to hold it a little farther away. So let's look at another example. Here's one of my own parrots who learned how to do this behavior. So here we're reinforcing him for just touching the tip of the syringe. And then now there's a little bit of water at the end. And then he's on his way to drinking a whole bunch of water. Now, one of the things you might have noticed there is that water kind of squirted out of there a little bit. Not a great syringe. We don't want the water to squirt out like that. And I actually asked around about what's a really good gliding syringe, which is why I mentioned the O-rings. They're the ones that seem to deliver fluids in a way that won't squirt it out like that. So Delbert's great at taking fluids from a syringe, which makes me very happy. In case he ever does get sick, I won't have to grab him up to medicate him. So now that you've got your bird taking water from the syringe, it's time to switch to some other substances. You might try something like juice, and I would go through your steps again. You're going to put just a little drop at the end of the syringe, let the bird get a taste of it and see how he responds. Reinforce him with your other reinforcer if it's a food treat or whatever. And then you'll gradually increase the amount of fluid, the amount of juice that the bird gets, as long as he's responding well. Now, once you've got juice going down really well, you might try some other fluids. One of the things I like to use quite a bit is human baby food, because they come in so many great flavors. You can get organic if you're concerned about making sure it's a good, healthy product. You can get organic baby food in lots of different flavors, like sweet potato and blueberry and peas. And so you can try different kinds to see what your bird likes best. And the great thing about that is if you do end up getting some medication that maybe doesn't taste super great to your parrot, you can put it inside the baby food as long as it's okay with your veterinarian. And that might be a great way to deliver the medication for your bird. So once your bird's taking all these fluids really well, you don't have to train that behavior every single day. Instead, what you end up doing is just maintaining the behavior. So that may mean maybe having a training session maybe once a month or maybe 2 times a month. That ought to be enough to help maintain that behavior. And actually, if for any reason the behavior breaks down, it wouldn't take much to get it back on track. It's really a behavior that often can be trained in 1 or 2 training sessions. So, and because you'd gone through it once with your parrot, it'd be easy to do it again. So let's look at that young blue-throated macaw that learned how to take baby food, human baby food, from a syringe. So here he is targeting to that syringe, just touching it with his beak. And then, I don't know if you noticed there, but I used my fist as a target as well to try and get him to put that head upright and sort of near that syringe. Kind of remind him what the behavior was. Now, he is a young bird, so you're seeing some baby responses there. And that's really important to notice, because one thing that can happen, especially with birds that were hand-fed from syringes, hand-fed baby parrot formula, they might go into a feeding response. Now, when you see that, you want to be careful about that, because you don't want them to aspirate the fluid, and we're going to talk about that in a minute. This little parrot really liked head scratches and attention as a reinforcer, so I'm using that for him as well. So he's doing a great job just touching the tip with his tongue. So now it's time to add some water, which he thinks is just great. Look at him taking that down. You can even see his eyes pinning just a little bit. He thought that was a lot of fun. So there's some of that baby feeding response we were talking about. And notice how nice and steady I'm keeping the syringe. Even though that bird's head bobbing and sort of pushing hard against it, I want to try and keep it really steady and try to deliver just small amounts of the fluid. We don't want any of that fluid going down into his lungs. So now we moved on to some baby food. This is a sweet potato flavored baby food. And as you can see, he responds really well to that also. Now, even though he is showing a lot of baby behavior, he didn't know how to do this behavior when we first started training it. I actually had to go through those approximations to get him started. It did go fairly quickly, but we did have to train it. So let's talk about that aspiration. One of the things we really want to avoid is having any of the fluid go down into the bird's lungs. This could potentially create a problem for them, which we don't want to add to any bird's situation, especially if they're already compromised. So some things we can do to avoid that is we can let the bird lick droplets of the fluid off of the syringe. Make sure you use small amounts of fluid. You're not going to plunge, 10 or 20 cc's of something down there. Avoid squirting the fluid quickly into the mouth. We're going to try and deliver it really slowly. Try to avoid chunky fluids, like, there might be chunky applesauce or something like that. And the reason you want to avoid that is because those chunks can get stuck in the syringe, and so you might be pressing really hard to get that chunk out of the way, and next thing you know, you squirt out a bunch of the fluid really quickly, and it goes into their mouth in maybe the wrong place. You also want to use that syringe that glides really easily, which is why I recommended the O-ring syringes. And you want to try to hold that syringe steady if you see that baby feeding response, like I mentioned before. So let's recap, and I'll give you some final tips here. Remember, you're going to try to avoid creating any fear response to the syringe. You're really trying to make this syringe a really fun thing for your parrot to interact with, so it's really important not to scare him with it. So that means you got to watch his body language. The moment you see him back away because he's nervous means that you've asked for a little too much. So take it slow. Present that syringe, but don't move it too much at first. You're really going to let the bird try to approach the syringe, right? And remember, small approximations are going to be your best friend in this kind of training. It's often a challenge for people to take it slow, but realizing that those little small steps actually help you move along a lot faster is what you need to remember. And another thing you're going to want to work towards is holding that syringe above your bird's head, sort of at a 45-degree angle, and that'll help you deliver that fluid a lot easier. Now I want to leave you with some great inspiration. This was another bird at the Gabriel Foundation. So this is another bird that had been given up for adoption. This isn't a professionally trained bird, and the people working with these birds were actually veterinarians and veterinary technicians that were learning how to train birds. And what I love is that this particular bird right here was trained by veterinarians. She taught the bird in one training session how to take water from a syringe. So pretty inspiring. Let's take a look.
We haven't got that far. I don't know what he'd do.
So I think he's ready.
But I
to
would
start
put it out where
training
he's
that
got
with
to
you.
reach just a little bit, and you got to start anticipating soon.
Isn't that great? She just got that this session. That bird hadn't worked on the behavior at all. So one session.
I think that look on her face says it all. She had a great time training this behavior, and the bird obviously learned something really important that he may need to use at some point in his life. So I hope you got some great information from this tutorial, and I hope you were inspired by that last video to go train your bird right now, because it's a great behavior. Happy training!